Nearly 7 million people in the U.S. are living with Alzheimer's disease. That number is expected to double by the year 2060. During Alzheimer's and Brain Awareness Month, we're talking about the things you can do to prevent the disease before symptoms start and new treatments. With me today is Dr. Marion Baumgardner, a neurologist and medical director of cognitive neurology at St. Luke's Marion Bloch Neuroscience Institute. Thank you so much for joining us.
Thank you for having me.
So first of all, Alzheimer's disease starts years or even decades before symptoms start. Is there anything we can do to prevent the disease before symptoms show?
Absolutely, Lindsay. Because there is no cure for Alzheimer's, preventing symptoms before they start is important. So living an active, healthy lifestyle, physically, mentally, and socially is key. For physical activity, the recommendation is 30 minutes a day, 5 days a week. Walking counts, but we see the most benefit when the heart rate gets up above 100. Yoga, Pilates, Tai Chi are all especially important for the brain because they combine both physical and mental activity at the same time. For mental activity, really anything that makes us think counts. So reading, crosswords, brain games, puzzles. Our brains are like our muscles. If we don't use it, we lose it. For social activity, we just don't want to isolate ourselves. So as far as diet goes, Mediterranean diet has been shown to be very helpful for the brain. Avocados, nuts, seeds, olive oil, these provide our brains with heart-healthy fats, which the brain can use better for fuel than sugar.
Great. And can doing any of these things help people who already have the disease?
100%. These things are not only important for prevention, but for treatment as well. In fact, studies suggest that they are as important, if not more important, than medications to help slow cognitive decline.
Great. Well, the FDA gave full approval to the first new treatment for the disease in more than 2 decades last year, and there's another one that's going through the approval process now. Tell us about these new treatments and what this means for patients.
There's a new class of medications called anti-amyloid antibodies. These are the first type of medications that target the underlying pathophysiology of the disease. Lecanemab is an anti-amyloid antibody that was approved last summer, but I'm more excited about a medication called donanemab. With donanemab, there is more potential to slow cognitive decline and for the benefits to outweigh the risks.
Okay, and then what's the difference between these new medications and previous treatments that we've had available?
Previously, the treatments really only targeted the symptoms. These are the first treatments that go after the actual underlying disease process.
How exciting. There's also a new exciting blood test for the disease. Can you tell us more about that?
At St. Luke's, there's a new blood test for Alzheimer's called beta amyloid 42/40 ratio that recently became available. The test comes back as having either a high or low probability of having Alzheimer's disease. For physicians, this is an extra tool in our toolbox to help aid in diagnosis, and it's a little bit more accessible for our patients.
Great. And what does this mean for patients?
In the past, we would have had to have done a lumbar puncture, so sticking a small needle in the back, pulling out some of the fluid that surrounds the brain and spinal cord and testing that for the Alzheimer's proteins. We would have also had to have potentially done a PET amyloid scan, which is still an option, but not as accessible for our patients.
Wow, so this sounds much less invasive, much more convenient.
Exactly.
Fantastic. Now, who's at risk for the disease, and what are some of the early warning signs?
While age and family history play a role, there are many potentially modifiable risk factors. So it's important to treat best we can cardiovascular disease, chronic hearing loss, mood disorders such as depression and anxiety, and optimizing good sleep. As we get older, all of our brains will shrink, so sometimes it can be difficult to differentiate between what is normal aging and what isn't. So if you or a loved one are noticing that there's more trouble remembering things that happened recently, or misplacing things more than in the past, or there's repetition of questions or statements, it would be important to get checked out. As the disease progresses, activities of daily living can become more and more affected. So if you're noticing that there's more trouble finding your way while driving, or trouble with remembering to pay the bills or paying things twice, it would be important to talk with your doctor.
Okay, good to know. Now, what's your final message for people who are watching?
I can't emphasize enough how important it is to live an active, healthy lifestyle. This is truly an exciting time in the world of Alzheimer's research. There is hope.
Great. Well, thank you so much for joining us.
Thank you for having me.
To learn more about St. Luke's Memory Disorders and Behavioral Neurology Center, visit stlukeskc.org/memory-disorders. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.